Thanks to Rajesh for those remarks. My name is Adva Saldinger, and I'm a senior reporter here at Devex. And I am glad that you could join us for this conversation about mobilizing private finance for global health. Part of the reason we're having this discussion today is that historically there hasn't been a lot of private investment in global health, particularly from DFIs and some traditional sort of development finance institutions. A lot of the funding has come in the form of grants and loans. And so we're going to dive in today to try to better understand sort of why that is and look at a few examples of where that is happening and what we can learn from them. So to start things off, I'd like to introduce Nafisa Jiwani, who's the Managing Director of Health Initiatives at the U.S. International Development Finance Corporation, or the DFC, as many of us know it. Nafisa, welcome. Thank you so much for joining us today. I wanted to really kick this conversation off with a question to you about why haven't DFIs invested as much in the health space as they have in other sectors traditionally? What are some of the key barriers? What can be done to address those barriers? And for a little bit of, historical data to sort of start us off, OPIC, which was the DFC's predecessor, had only about 10% of its portfolio invested in health investments, right? So much smaller than other sectors where DFIs have traditionally been more active. So what can you tell us about why that is, about why things have been constrained in this space?
It's a great question. I get asked it very often, even within our own agency and with their leadership. And I would say, a couple things. One is, you brought up that most of the time when we think about global health, we think about aid and grant dollars. And that's how we've traditionally invested in global health. And here's an opportunity for us to think differently. And there just hasn't been as much private investment to create sustainable health solutions. Other than that, I think that there are real risks in doing global health projects for DFIs. And it's not surprising, but it's hard for us to ignore, especially when you look at risks around business models that may be incredibly innovative, but have insufficient focus on commercial viability. And we see that often in the global health space. Another area is that we, often see companies who are transitioning from academia to the NGO space and coming to a DFI that just may not have had a good sort of transition of how to interact with the DFI. And so they're, trying to get some technical assistance on how to do that, hiring a CFO, creating a business plan, understanding what an ROI would look like for a DFI. I would say another risk, and you probably know this well, Adva, given all the work that you're doing, is emerging markets have a greater risk around everything from diligence, executing, deal structure, which increases the overall transaction costs. And of course, there's a risk of failure relative to other opportunities. And that is something I think DFIs are obviously worried about. And I would say the last sort of barrier that I might want to point out, especially as we're thinking about PPE or vaccine manufacturing, is that there are legal and regulatory structures or lack thereof, which also make it really difficult for DFIs to push forward an investment in that space. All of that being said, at least for DFC, I will say that there has been a tremendous level of support from across the USG to support these innovative global health projects to really create sustainability around a lot of the work that we've done from an aid and grant dollar space.
So I wanted to follow up on that because the DFC last year in May announced the Health and Prosperity Initiative, which is a commitment to invest $2 billion in 3 years in global health. So give us a little bit of a progress report. How much has the DFC invested thus far? Where are you sort of focusing your efforts? How much of this is, sort of COVID specific versus, other diseases or health systems? And what have you learned thus far? How is it impacting the way DFC is doing business? Is it, really actually ramping things up so this is more of a investment line for the DFC?
So I'll start off with answering your last question. It is a priority for this administration. It's a priority for the last administration, continues to be a priority for this administration, and a strategic focus for the agency. I have learned a lot in the last few months, but I will say that we as an agency, we are ambitious. And I think over the last 9 months, seeing the way in which we have moved much more quickly on transactions, I think, than we ever have before by being much more creative about how we do due diligence or finding ways to be a little bit more streamlined in terms of our processes has helped us, I think, move through transactions a little bit quicker. So I will say that we are ambitious. The last few months have made me appreciate our agency even more today as we continue our strong and strategic focus around global health. And like you mentioned, it does not come without challenges. I want to say that, for us, what's been helpful is learning from DFC's, one of DFC's first initiatives that was focused on global health. So while we, announced the Health and Prosperity Initiative in May, the DFC had its first initiative, which was the Moms Initiative, and it's a partnership between the DFC, USAID, Merck for Mothers, and Credit Suisse to invest $50 million in companies focused on maternal health. And learning from that partnership, I think, has been incredibly helpful and informative for how we were thinking about the Health and Prosperity Initiative. To date, the Moms Initiative has invested in 3 companies that are improving maternal health outcomes in sub-Saharan Africa, which is Life Bank, Johnny Clinics, and Penda Health. So I would say that, one, while there was a small portfolio focused on global health prior to us transitioning to the DFC, it was a focus then, and we're using those learnings to say, how do we improve how we do business now? Maybe a few other things to point out. When we were OPIC, we had a US nexus that was required, and that no longer is a requirement for us. And I think that's made a big difference, especially when you think about the global health space in terms of what we can do. We also have an equity tool that did not exist before. We have a technical assistance tool, which is, a soft loan. And again, I think those are some of the tools that we just didn't have as OPIC that really have helped us to accelerate some work in this space. DFC is committed to advancing new global health investments across the world. And we were really focusing our efforts on how to combat the pandemic, of course. And so everything from looking at opportunities around vaccine manufacturing, diagnostics, therapeutics, PPE, but also really how can we support the global health ecosystem long term? Okay, because today we're dealing with this pandemic and tomorrow it's going to be something else. So how do we think about supporting the global health ecosystem long term through healthcare delivery, digital health, supply chain and manufacturing for both communicable and non-communicable diseases? I say this often because I think sometimes we forget how important NCDs are as well. And we also continue to look for projects focused on expanded access to clean water, sanitation, nutrition. And again, we're looking at, projects that are viable that can stand on their own commercial merits. And if we continue to do that, our agency can help create a global health ecosystem that is self-sustaining. And again, for me, coming from a public health background, I really think about how do we outlast immediate crisis and prepare for the next.
Thanks, Nafisa. I want to now bring in a couple other people into our conversation. Ben
Sure.
Hubbard, the CEO and co-founder of Parsyl, and Kennedy Okong'o, the East Africa director of the Medical Credit Fund. And Ben and Kennedy both have experience structuring deals that bring in private capital and have worked with the DFC. And so I want to ask both of you to tell us a little bit about these interesting and innovative deals that you've been a part of, and why you turned to a DFI to help finance them, and sort of how you went about that, and how you think it's best to engage with a DFI like DFC or others. So Kennedy, let's start with you. Tell us a little bit about the Medical Credit Fund and the recent deal that was announced with MCF and the DFC.
Thank you, Adva. The Medical Credit Fund has been in existence for over the last 10 years, having its operations in sub-Saharan Africa in 5 African countries. Over time, we've been providing debt capital to primary healthcare providers, that is the health SMEs in the market, sourcing money from a few investors here and there, just putting it together, coupling that with the technical assistance. So over the period of 10 years, we've deployed close to $100 million US dollars in debt capital, done in over 5,000 loans to around 2,500 clinics, meaning a majority of them have been able to come into the cookie jar more than once, taking a facility, taking a repeat facility, and taking another facility. again, now coming back into last year where COVID hit, we've been in this field for over 10 years, just trying to ensure that we have clinics that are well prepared to take care of the normal ailments that we have, communicable diseases, non-communicable diseases. Then the pandemic hit, and all of a sudden, the discussion is all about PPEs, the discussion is all about coming up with vaccines and all that. All this time, we are forgetting that malaria has not taken a break. All this time, we are forgetting that tuberculosis has not taken a break. All these other diseases that we've been suffering from in Africa haven't taken a break, yet everybody else is focusing a lot on just eradicating the pandemic and finding solutions to the pandemic. So you found that now the playing field has been skewed. Everybody's talking about this, yet all these other things that exist and having a very high mortality rate in Africa are being forgotten. So at this juncture then, the Medical Credit Fund that really wanted to ensure that whatever clinics we've always brought up to speed are not left behind, we had to look for a partner who was able to not only come in and look into the future with us, and also not forget where we are coming from. So we got into this arrangement with the DFI. We got a facility of $30 million US just to ensure that all these other existing diseases are not forgotten at any given time. Thank you, Adva.
And Ben, tell us a little bit about the deal that Parsyl has done. And I know another partner there is Lloyd's, which is, a really old insurance company that hasn't been involved in quite the type of thing that you guys have helped to put together.
Yeah, sure. Thanks for including us. I guess maybe a couple of pieces of context. Parsyl, as a company, we're a technology company. We make sensors and software, little sensors that ride with sensitive products like vaccines. So we understand what happens to them as they're being stored and shipped around the world. We're also an insurer, so we insure those products in the case something bad does happen. And I think the other interesting piece of this, I used to run something called the Development Credit Authority at USAID, which is now part of DFC, and had a little bit of experience on the DFI side of this, which in healthcare has always been a challenging space to lend into, to invest into. And one of the interesting learnings I've had since leaving government and starting Parsyl is this kind of invisible, really important role of insurance in lower middle income countries, low income countries. And we have all these traditional DFI tools, credit enhancements, loans, now equity that can be used, but haven't traditionally been used to support insurance. And as I looked deeper, you see the sort of market failure, market gaps around insurance. So if you're a small business, yes, you need a loan, but you also need to get insurance to bid on that government contract. You also need insurance as part of getting the loan. And you can kind of look across a number of different sectors, but in healthcare, as it turns out, if you're a country, you need insurance to get the vaccines from Gavi. You need insurance to get the AIDS and TB and malaria products from the Global Fund. And so it plays this very important invisible role. But the other part of what it does, in addition to just sort of protecting the products if something bad happens, it brings private capital into these sectors where they now have skin in the game, and they're very incented to want to help manage the risk of those. And so we looked at the vaccine supply chain prior to the pandemic. It was actually a year ago, Nafisa and I started to get really excited about this. How can we use DFC's tools to address this market failure and this huge, super important protection gap? And then with COVID-19, obviously that is just accentuated the need, where we have a lot of really important life-saving products that are unprotected in these markets. So it's a simple and a complex deal at the same time. But at the core, what we're doing is we're pairing risk-sharing tools that DFC has, and they're sharing risk with the insurance market, a dozen other insurers, and then we're using data and visibility as a technology company to be able to give insurers visibility into these risks, to be able to give the client, ministries of health, Gavi, risk management, to make improvements. And doing that, we've been able to unlock billions of dollars of insurance capacity to be able to insure COVID-19 distributions around the world. And so we're really excited. This just started January 1st. We started trading. We did it in lightning speed, at least for a development bank. It was very fast. Not as fast as maybe a venture capital investor, but certainly very fast. And we're really excited about it, and lots of good lessons, I think, for both Nafisa and I and our teams in doing this, because it really was a really first of its kind transaction. It all takes place at Lloyd's of London. This is the first time a government has ever invested in the Lloyd's insurance marketplace. So we're really thrilled to have broken some ground.
Thanks, Ben. Ben and Kennedy, I wanted to ask both of you, because you're working in this space, about sort of what you see as the greatest challenges of mobilizing private capital for these investments. You know, Kennedy, you were talking about how the Medical Credit Fund has been doing this for a long time, trying to raise money from investors, but I'm sure it hasn't always been sort of easy to get the scale of investment that you might want to meet the demand that's out there. And Ben, obviously, you know, drawing on your experience in government in the U.S., I think you have sort of a really interesting take on what the potential bridge also is between sort of that more grant capital or loan capital and sort of this private capital, and where we might see some gaps and how they could be addressed. So do either one of you want to jump in on that first?
Yes, Adva, thank you. Just to pick on what Ben had earlier said, that the health space is considered to be a very risky and volatile market that nobody really wants to look at. If you look at it currently globally, everybody wants to be at the Silicon Valley. But in the Silicon Valley, you will not find a health SME being discovered. Health is something that has been here since time immemorial. As long as somebody is born today, you're bound to visit a hospital in one way or another. Either you'll be born in a hospital. Unfortunately, if you are born somewhere in the rural villages in Africa, you may not be in a position to reach a hospital. But immediately after that, you may need to see a doctor or something. So we've been having this challenge of everybody having a perception that health SMEs are high risk, which has been demystified over the last 10 years that the Medical Credit Fund has been in operation. We've really proved to the world that health SMEs are actually bankable. If you look at our non-performing book in relation to the industry average, we are normally always way better, because at any other given time, the worst that we hit is a worst case scenario of 3% non-performing. But if you look at the industry average, comparing with the commercial banks, comparing with the non-financial institutions that are operating in other sectors, you find them struggling with around 15, 20% of a non-performing book at any other given time. So this perception of health SMEs is actually very risky. It's something that a majority of the people are looking at it and saying, no, this is a venture that we really don't want to look at. Secondly, we've not really had a good government support in terms of bringing private health SMEs. So a majority of the time we'll be left to worry about grants, and grants are quickly drying out the world over. We cannot really rely on grants on a very key thing, that is the well-being of the workforce of a nation. Because the moment a nation has unhealthy people, then it means that nation by itself will not actually survive. So the key thing is to ensure that, first of all, everybody is healthy, everybody is able to attend to their duties. So this notion that now we cannot really, we want to build in a lot of motor vehicles, but who are going to drive these vehicles? We want to put in a lot of machines to be able to do X, Y, Z. But if the people are not really healthy to run these machines, then it means the entire world is running in a different directions. So at the Medical Credit Fund, over 10-year period, we've proved to financial institutions that health SMEs are actually bankable. And we've given loans to as little as $100 to a health SME facility somewhere in Africa. And these loans have been repaid. And that's why we're having customers coming back and back and back to us. So yes, we've demystified this myth. Thank you.
I mean, quick comments on that. I think that, you know, it's very important, to Kennedy's point, that we're bringing and crowding in private capital and private sector innovation. And DFC, you know, has a risk appetite for doing tough things in tough places. And that's really important. We wouldn't have gotten this partnership done without that kind of appetite. They're also in some ways very risk averse and bring kind of a lender mindset. So I think one thing we need to do in the health sector is bring a little bit more of an equity mindset in terms of taking more risk, looking at kind of long-term value creation rather than necessarily cash flow based, because it just requires more patience. And I think those are tools at DFC that they're nascent now, but are developing, is my understanding. I think that the more DFIs are teaming up with the large spenders in this sector, so the Gavis, the global funds, the PEPFARs, USAID, it's really important that donors are not crowding out the private sector and private capital. And as much as people say they're not or don't want to, it happens. And I think the more they're creating market incentives, the more we're getting private actors into these sectors, we're just going to have more of a sustainable financing structure. But it really does, all the money in this sector right now is from donors. And it does suppress private capital and private innovation. We experience that directly ourselves.
Yeah. Well, speaking of the Global Fund, John Fairhurst, who's the head of private sector engagement at the Global Fund, has submitted a question for us. So I'm going to go to that video questions. Our producers are going to play that for us now.
Working in an organization that has 20 years experience of reducing the impact of disease in low and middle income countries, we've seen up close the direct and collateral damage diseases do to people's lives, their livelihoods and their country's economies. The last year has shown the world the depth and extent of the global economy's connection to global health and the effectiveness of health systems. And looking at the basic economic analysis of the damage versus the cost of prevention, it's clear health has been a blind spot for DFIs and the private sector. A survey of Fortune 500 companies in 2019 showed that only 9% have a global health strategy, and the majority of those are pharma or health companies. We're all desperate to go back to business as usual, but in the space of investment in global health, none of us, including those in the development space, should want to return to that kind of business as usual. If we are to collectively and radically change this underinvestment at real scale, it's about new attitudes and new types of instruments, new platforms. We at the Global Fund are working on some of those, but what does this look like to you?
So we've only got a couple minutes left here, but if I can go to each of you for just sort of a 1-minute response to his question, that would be great. Kennedy, do you want to kick us off?
Thank you, Adva. Just to answer John, I would say that the future looks really bright and even is getting more brighter. Looking at the arrangement we've had with DFC and getting $30 million on the table at Medical Credit Fund, we are able to look at this and come up with innovative ways to ensuring that money actually reaches up to the last. We've come up with innovations whereby currently we are dispatching a total of $4 million on a monthly basis through a mobile platform that does not involve a lot of analysis, a lot of people in the system, in the process, so that we are able to deploy this capital quickly and faster. And so with the help of DFC, with the help of this initiative that we are having, then we'll be able to actually move even quicker to ensure that all these primary healthcare providers, all these diseases that we are having in Africa are actually taken care of. Right now, if you walk into a clinic somewhere in sub-Saharan Africa with just malaria fever, everybody first thing is, this is COVID, and people really want to run away from you, as opposed to really giving you the basic help that you need. So people will classify you as somebody who has COVID as opposed to the disease that's actually affecting you. So we really want to ensure that we reach all these primary healthcare providers. We provide them with the basic PPEs. We provide them with everything that they need to just ensure that, yes, we take care of COVID, but also we do not lose any lives to any other diseases that were there.
Great.
Before.
We've got 1 minute left. So Ben and Nafisa, if you want to just quickly.
10 seconds for me. I think it's really a mindset around how do we use donor capital, if I'm answering the Global Fund question, not to go and do the job ourselves, but to de-risk getting the private sector to come in and do it with us or for us. And that's not suitable for everything, but it is a change of mindset. And if you can help create the incentives and take some of the initial risk out, you can actually prove a market and shift this to a much more sustainable model.
Nafisa?
I will finish things off with, I feel like this is the time for global health to make its mark and to shift the way that we traditionally think about things. And I guess, my call to others is, to answer the question around how do we sustain this new way of thinking and how do we plan ahead?
Great. Well, thank you all so much for joining us and being here. Obviously, this can be the start of many more conversations because there's a lot of ground for us to cover here. And to everyone who's joining us, I want to say that next you're going to hear from Hala Audi, And then my colleague Amruta will moderate a session about global health equity. Thanks.